Good afternoon, it's Mayor Turner. I just wanted to give you the latest numbers we just got in. We start with the surrounding communities. So we start with Amarillo. They're at 3880. Just got the latest numbers from Lubbock. They're at 3475. Abilene is 1152. San Angelo has risen to 530. Midland sits at 976. And we just got our numbers. We are now at 1602. We have had 12 deaths. Currently, we have 662 that are recovering, that have recovered. And there are 938 tests that are pending. So I want to give you some information from two of the free clinics that we have offered. We had one at Sherwood Park. They tested 197, 47 of which were positive, so about 25%. At Woodson Park, they tested 208, and 49 were positive. So again, it was 25%. There will be two more next week, one on Tuesday, one on Thursday, and I will get you the information about that first part of the week. Give you an update on the hospitals. Both hospitals had been diverting, which means they do not take any people from outside the county into our hospitals. The reason they do that is not necessarily that they are full on patients. The problem they have is they run out of nurses. Both hospitals are very struggling right now with nurses, because they've gone out into the community and got sick. Right now, I know Medical Center has had around 20 nurses and staff that are out being quarantined. Right now, ORMC has 13 that are out, so that is very concerning. Right now, Medical Center has 48 COVID patients on 2 different floors. Currently, 9 of them are on ventilators. They have 501 pending test. ORMC has 15. We have been getting some numbers really to start to rise. It seemed to have slowed down the first of the week, but now all of a sudden the numbers are starting to go up. Give you a little bit of an idea where we are on nursing homes. Focus Care has had 21 cases. Siena has had 15 cases. Buena Vida has 3, Courtyard has 5, and Madison has 7. Those are the nursing homes that are showing up positive right now. If you would, there's a great document that Russell showed, which shows all the regional hospitals, which include San Angelo and all of the West Texas, most of the hospitals in the Permian Basin. It shows the number of patients and the stress on the medical system. And it has a code. It goes normal is 0 to 25, medium is 25 to 50, high is 50 to 75, and severe is 70 to 100. Last week, we were right at the middle of normal to medium. This week, we have rolled into the high, which means there is a stress on our hospitals. So we are now at 61.7. That's a great document for you to see. So you might want to look at that on the Medical Center press conference that we just had. Like we talked about, the hospitals have been on diversion. They are actually not, but it really depends upon who comes in the door. I know RMC has been on diversion until last night. Same thing with Medical Center. What we see is a lot of people coming in from Crane, one from Reese County, one from Big Springs, one from all down south. And so what happens is when the hospitals get to a point that they really can't service any more patients, they divert from anybody outside of Ector County. Heard an interesting piece of information that you may find a little surprising. Lubbock right now is taking some of San Antonio's cases due to the severe strain that has been put on all of the hospitals in San Antonio. So they are shipping them all the way from San Antonio to Lubbock. So just going to be honest with you, numbers are running up. There is a lot of concern with the medical community about what happens after July 4th. So we're about a week to week and a half out of July 4th. We are concerned about the numbers going up. The stress on our nurses that are working every day, 12-hour shifts, is really starting to get some of them down. We're very concerned about the nurses. If you know one, please tell them thank you. They're doing God's work right now. So that's where we're at. Just going to be honest with you. City Council is going to move to WebEx just to make sure that we don't mix people and get the staff sick. Right now, we've got a couple of council members who are going into quarantine because they have been exposed. They don't have COVID, but they are taking the steps they need to make sure they don't expose anyone else. Heard somebody mention the president. The president is going to come out probably the end of July. I don't have a lot of details on that. I just saw that information today. I probably will get some as we move forward, which I'll be happy to share any information I can share. People have talked about the schools. It is still very early. But right now, the schools are going to leave it to the parents to whether they go to school or whether they stay at home and learn. Because we just don't know what's going to happen with the numbers, and our numbers are really driving what will happen with the school district. If our numbers keep rising, it's a concern for the kids. So that's all I know right now is there probably will be some school that will go to the school, but it will be the parents' option. And from the way they're talking, they said, once you make the decision, well, my child is going to go to school, you have to stay with that option through the grading period. But like I said, that's all in the works. I know superintendent and all of them are working hard. The colleges are still working to look at the best options. I'm sure there will be a lot of distance learning and things like that. One thing that Dr. Woodley said today is they're hearing that one conference may come out and say that there will be no football in that conference until the spring. That's all very early to say that there will be no football, but one of the concerns is if we start this football season, you get half your team sick with COVID, you're forfeiting games. And that's what they're working through, but that's just very early. But folks, it's serious. I know there's a lot of people out there saying, no, it isn't, things like that. Protect yourself. I'm not saying that we should go into a hole and not come out. I know the masks are very political, but I would ask that you wear your mask if possible. I understand some people have problems breathing. I'm an asthmatic myself. I don't have any trouble breathing through mask, but please, if you feel bad, you start running fever, anything, please quarantine yourself. So, that's probably one of the biggest problems we have is somebody doesn't know they're sick. They may be asymptomatic, which is you have it, you just don't know you have it. And those people go into the community, or people that think they're sick and go to work, they expose other people. And that's really what's driving a lot of this. We do have a higher number of Hispanics. We have about 61%, according to the last census, Hispanics in Ector County. It's up to 70% of the positive cases are Hispanic. So we are trying to determine why that is, whether it's family dynamics or anything like that. But it's dangerous. We are up to 12 deaths in Ector County. Our neighboring county is up to 17. So please be careful. Please wear your mask, wash your hands, social distance, all of that. We will be coming out. Probably I'm going to talk to some tomorrow to talk in the city as far as size of groups that we will allow to come together. I know there's weddings, I know there's quinceañeras, everything else, but right now we've got to take care of the kids. Somebody asked about masks at the schools. I don't have any idea what the regulations are going to be. School district purchased over 1 million masks, so masks will be taken care of there. I applaud Scott and the entire administration for taking care of that. So that's where we are. God bless each and every one of you. I will see you on Monday when we have the next set of numbers come out. If there's numbers jump up dramatically Friday, I will be back on Friday to talk. God bless each and every one of you. Please stay safe, and thank you very much.